shade during this past year from June 2020 to 2021. What a year it's been. As I leave my post and welcome Liz Moe as president, it is hopeful that the worst of COVID-19 pandemic is behind us and that we can look forward to a bright future with even more successes of bringing people together around public health, as well as abolishing health disparities and structural racism that bring us all down. As always, we begin our meetings with the Ancestral Lands Acknowledgement. We ask that you take a moment to honor and acknowledge that we are on ancestral homelands of the Dakota and Anishinaabe. Indigenous people have had a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and US governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself. So as a reminder, this meeting is being recorded. Video settings are your choice, but we ask that you keep yourself muted and use the chat box for any questions you may have. Today, we will be introducing our governing council and we'll be providing a brief financial summary as well as committee summaries. Finally, we will be taking a member vote on our updated policy resolution titled The Impact of Climate Change on Health. A huge note of thanks to our departing council members, past President Nancy Frankie Wilson, Treasurer Michelle Brazier, Secretary Cindy Kallstrom, members at large Julie Myrie and Claire Fleming Savangse, and student reps Anju Vidam and Elise Haven. Welcome to our newly elected governing council members, President-elect Ellen Solaris, Treasurer Jessica Flatterud, Secretary Summer Robbins, Affiliate Rep Kristen Moore, and members at large Antonia Apollinario Wilcoxon, Michelle Clegg, Alyssa Fritz, and Connie Norman. So here you see your governing council for 2021 and 2022, including committee chairs. Note that there are a couple of student rep positions open this year. It never is too early to consider putting your name in for next year's leadership positions. And it's never too late to consider running for office or becoming more involved in MPHA. I encourage all of you to consider taking an active role in MPHA. Another opportunity to consider is nominating people who have helped to advance public health in Minnesota for awards next year. Although it seems like a year ahead of time is a long ways away, we get busy with our own things and time passes quickly. So please take that into consideration as well. You can check out all these opportunities as well as the latest MPHA activities and events on our website at mpha.net. Finally, before I hand it to Mary, who will review the financial summary of this year, I want to acknowledge the amazing work of our awesome executive director, Mary Grand, who holds the moving parts of MPHA together. Thanks to Mary and all committee chairs and members who have contributed so much to MPHA in this past year. This organization would not be successful without you. So with that, Mary, if you want to take it.
Sure. Hi, everybody. Thanks for joining. I'm Mary Grand, MPHA's part-time executive director. I use the she, her pronouns. And we're just going to go quickly to give everybody a brief recap of what we've done in the past year. Some amazing committee work, and I'm excited that you guys will get to hear brief introductions of a lot of the committee co-chairs. And Michelle Brazier is our outgoing treasurer. And so I want to thank her for helping with this as well. So let me just change the view here. I won't read all the numbers here, but MPHA is doing well financially. You can see our total account balance. And I would say that our sponsorships and for our policy forum and our yearly conference, grants and individual donors have been holding pretty steady. So that's really nice. We certainly appreciate that. This is a streamlined organization, and so we couldn't do this work without a lot of help. And just a note from our accountants that we did have a small profit last year, which was great. You know, a lot of nonprofits were not able to do that. And then I want to briefly mention one of the most exciting things for MPHA, and I think most of you have heard about this, but we have received a very generous award from Blue Cross Blue Shield of Minnesota with a $100,000 funding award. And this is to further our anti-racism work. And it will be for a 1-year period. And it's really to build up our racial and health equity advocacy capacity. And it's an investment. I'm really impressed with Blue Cross for putting this funding, they've made statements and they're doing a lot of work, as you guys know, with other organizations as well to further this work. So you can read more about it on our website. I want to make sure that everyone knows it's an open invitation to join the planning meetings for how we're working on this. We had our first meeting yesterday, and just email me, admin@mpha.net. Also, the meetings are listed on our website. So we have 2 more planning meetings coming up in June, and this is to figure out our work plan. So you'll hear a lot more about all of this and coming up soon, but the types of things we'll be working on are leadership training, skills-based training for not only within MPHA, but also really looking to deepen our collaborations and partnerships, cross-pollination with other organizations in Minnesota that are already in this work, with anti-racism in public health. So there's a lot of exciting stuff coming up, and we look forward to working with everyone and having everyone join us. And now I'm going to pass it on to committee co-chairs for each committee to just briefly introduce themselves so you guys can see faces with some of the names that you see, and they can talk about a couple highlights from their past year.
So I'll jump in then, if that's all right, Mary. Hi, everyone. My name is Kristen Moore. I am one of the co-chairs of the Communications Committee with Callie Plump, who wasn't able to make it today, I believe. But I just wanted to give you a little bit of information about our committee. We've worked really hard on elevating social media activity. So you'll see us on Facebook, Twitter, Instagram, LinkedIn, as well as a new YouTube channel, which we just started. So if you see our posts out there, make sure to interact with us, like it, share it. If you have ideas for things that you'd love to see on there, please let us know. We also worked on an op-ed that was published in the Min Post earlier this year, and worked with MPHA's Health Equity and Policy and Advocacy committees to respond to some of the events that have occurred over this past year. And finally, one of the things where you'll see us monthly is the membership newsletter, which our wonderful MPHA engagement specialist, Emily Acers, who's on here, has worked really hard on and does a wonderful job every month. And we're so appreciative to her for doing that for us. So thank you, Emily, for that. And I think that's all. If anybody has any interest on working with the communications committee, please feel free to reach out to us. We'd love to have you. Thank you.
Hi, folks. My name is Flaris. My pronouns are she, her, hers. I'm actually an exiting membership committee co-chair, but since this is a look back, that's why I'm presenting. Our new co-chairs are Delaney Anderson, who is on here, and Michelle Clegg. I don't know if Michelle's on here, but I hope you'll welcome them as they continue to steer the membership ship of MPHA. In the past year, we had a big increase in our virtual programming options, both events that were for members only and broader general events. We continued to work to decrease membership barriers, and particularly based on feedback from our 2020 membership survey. We did a membership sale for the first time ever, both based on that feedback and recognizing the impact of COVID-19 on people's employment and their ability to support themselves and their families. So we had a membership sale for the first time, which was 50% off. We also created a new reduced price membership level for individuals who are unemployed, affected by COVID-19, or an early career professional. And I'll also note that we did fundraising with Give to the Max Day to support both conference scholarships and support reduced and free memberships. So if you know anyone who should be a member, but cost might be a barrier, please know that we have multiple ways to support people engaging with MPHA. We had some new types of programming that we did, coffee chats. There's a lot of really great events coming up, some intersectionality conversations, events around skills. So please, there's a lot of programming and ways to engage with MPHA. And like Kristen said, the committee is always looking for people to join and always open for suggestions, topics, types of events, volunteer opportunities. Thank you.
I'll just jump in here to say kudos to Ellen and Emily for facilitating and setting up our most popular virtual event this past year, which was a talk with Dr. Osterholm. So big kudos to both of you guys. And it is a super fun committee. I just wanted to say that.
There's also an exiting co-chair.
Okay, we don't have a committee report from the Global Health Committee. They are currently have an open co-chair position, and they're meeting in tandem with the Health Equity Committee right now.
Mary, that's me. So the Health Equity Committee, this is Jaime Martinez, and I am co-chair of the Health Equity Committee, and my co-chairs are Melanie Peterson-Hickey and Erica Fishman, and they selected me to present our slide today. And so our committee has been quite active in the last few years, working on racial equity and health equity. And we always invite people to come and join us, because it's a really eye-opening discussions that we have and topics that we engage in. And so you're all welcome always. So this year, we've responded to several things that have happened in the environment, as you all well know. Some of the issues that have occurred that have been sad for all of us and have been very stressful. One of those was denouncing the insurrection that took place on January 6th at the U.S. Capitol, and also the responding to the killing of Daunte Wright by police, and then final verdict of Derek Chauvin trial. So those were active things that we were involved with in writing statements. Also speaking out against anti-racism, we've joined several partners from the state to make statements around the issue and supporting other AAPI organization in Minnesota. We also were quite active in having discussions about sending President Biden a letter, and also Governor Walsh in Minnesota, in our Minnesota congressional delegation, to rescind the executive order 13950, which was combating race and sex stereotyping. So as you well know, that was in place during the last administration, and we were actively, proactively asking the new administration to rescind those last orders. We've continued to do outreach to several APHA state affiliates and APHA leaders to adopt land acknowledgement statements. As you saw when Kathy introduced, introduced the opening of our meeting today. So good news to let you know that all this work is paying off, particularly at APHA. We just heard that APHA has begun a discussion with their American Indian Caucus in developing a statement, acknowledgement statement for APHA. And we originally organized at the local level or at the state level so that we could move it towards APHA. And so that's a really positive outcome. Finally, we've been involved in various policy initiatives. We've testified at several House Select hearings around racial injustice, and also provided local testimony on various topics in the metropolitan area. So again, always room for other folks to be at the table to discuss issues. We try to work collaboratively with the other committees so that we have more support and can expand our work around racial justice and equity. Thank you, Mary.
Thank you, Jaime. Donna Anderson is I think Donna, you're on. If you want to say a minute of, about this slide, you can. Otherwise, I can also read it.
Well, I'll start. Thank you to Mary. I'm sorry that I can't be seen today because I have a little tech issue for the last 6 weeks, but I can see and hear you all just fine. So you'll only get my audio today. Our biggest news was the $10,000 grant we received from the Minnesota Historical Society, part of their Cultural and Legacy grant. And this is to digitize some of the public health journal tapes, of which our past president and former health commissioner Ed Ellinger was the longtime host. So this is a very exciting piece. This will be a marvelous collection when it is done at the end of this calendar year. And then we've also continued to promote our archives collection, which is at the Social Welfare History Archives on the West Bank of the University of Minnesota campus. And we have an exciting agenda for the next, it's probably multi-year, where we want to get refocused. Projects such as piloting the electronic transfer of our records, our MPHA records, so that they can be integrated and people can have online access of MPHA's wealth of material that we have in our archives. I'll just say we want to stay in touch with all the various committees of MPHA, because we have within those committees there is interest in history, and we will complement and help you with your work that has a history connection to it. So thanks, Mary, and thanks to everyone. We're alive and well.
And I'll mention that Sherry and Ann Sakowski are the co-chairs of the leadership committee, and you'll be hearing more from them pretty soon when we start the awards ceremony. And Annie Holland and Laura Klein are the co-chairs of the Policy and Advocacy Committee. So if Annie and Laura, if one of you wants to go over this a little bit, and we'll get to our resolution.
Yeah, I can take this. So I'm Annie Holland. I'm the one of the co-chairs for Policy and Advocacy Committee. Laura Klein is my other co-chair, and she is just sent me a message saying she's dealing with some fussy babies right now. So I am your gal. So the Policy and Advocacy Committee, we identified priorities in the fall of 2020 based on a member survey. Those largely remain the same from the previous year, really with a strong, even stronger focus towards health inequities and anti-racism work. And then also continuing our work with affordable healthcare, public health funding, mental health, gun violence prevention, environmental health and justice, and adding the efforts to reduce impact of COVID-19 in Minnesota. And we hosted a pre-conference session related to the MPHA conference and related to anti-racism and policy, which was well attended and very successful. And then we continued some relationships with coalitions. We have a long list, but this is a short list of the coalitions that we are in more frequent contact with. And we also have sent out action alerts and advocated for issues and have worked quite a bit with the Health Equity Committee. So thanks to that team and leaders for all of that work. We also have shared a committee intern, Morgan Mulhern, who's been wonderful. Then we've also, oh, and I should just say that the issues that we've been advocating on primarily have been, Jaime mentioned a little bit, but there was one on equitable vaccine distribution for COVID, and then also SHIP funding continues to be come up on the agenda for cuts. So that was another one that we had to jump into action on, and tobacco cessation and making sure to continue that funding. And then also we have a resolution we will vote on today. But we also approved resolutions via an electronic vote in the fall around universal access to universal school meals and racism as a public health crisis, both of which really led and championed by the Health Equity Committee. So again, a big thanks and some great cross committee work there. And that is all I had on that slide.
Thanks, Annie. I'll jump in next. Hi, everyone. I'm Lindsay Fabian. I'm here presenting on behalf of the Policy Forum Committee. Our chair is Angie Carlson, and our other committee members are Jean Streeter and Leah Berg and me. And thank you to all of you who may have joined one of our virtual forums over the past year. We pretty quickly converted to Zoom-based policy forums and thought we could handle that. And I'm happy to say and proud to say that we were able to transition our forums to Zoom-based and do a virtual set of 4 forums this year on the very important topic of environmental health and is there justice for all. And we had 4 events throughout the academic year, which you can see on the screen, about water and places and neighborhoods, vulnerable populations, and our public health response was the final one we did in May. If you weren't able to attend any of them, they are thankfully all cataloged both on Facebook and on MPHA's YouTube channel. So feel free to check those out there. And over the summer, our committee will be gathering and taking a look at the feedback you all have provided on suggestions for topics and speakers, and watch for an announcement this fall for our next series. There's hope that we'll be gathering in person this fall, so please stay tuned for that, and we'll continue to have a virtual option to continue to keep the forums open and accessible to all. So thanks again for staying involved in the policy forums and supporting our virtual forums this year.
Hi, everybody. This is Liz Mo, and I am your incoming president-elect, but I am really proud of the work that our committee, the annual conference committee, did this year. it was such a joy to be part of this group and to lead this group in trying to figure out how to offer a virtual conference that would build on the in-person conferences that we've all attended in the past. So we had 2 half days, 2 short days, including and a pre-session from Policy and Advocacy Committee. And it was well attended. There seemed to be some good energy. I was proud of the way that we asked for breakout sessions, people to apply for breakout sessions, and grouped them around the areas of the strategic plan. And so one of my favorite parts of the conference was actually is like maybe a little bit, it's only there if you know what's in our strategic plan, but each of our breakout sessions was organized so that you could see all the work going on across the state and in all different kinds of ways that addresses what MPHA is setting out to do with with these few years. So of course, the keynote speakers were great, and we had a lot of great participation with the 21-day challenge, including sessions at MDH after to kind of continue the conversation and continue the work, and sessions with MPHA after. And I also want to extend my appreciation to the collaboration from the co-chairs of the Health Equity Committee, co-chairs of the Policy and Advocacy Committee, and Mary did a tremendous amount to keep the show running and making sure everything happened. And Ellen Solaris, who was formerly the membership committee chair and is now president-elect, will be chairing or co-chairing the next meeting. I also want to extend my sincere thanks to Rosamond Owens, my great friend, who co-chaired the annual conference with me. So thank you. Thank you, everybody.
Thank you for all those reports. We've done an incredible amount of work over the past year, despite COVID and all the disruptions in our work. We now have a policy resolution update that Annie Halland, one of our policy and advocacy co-chairs, will be telling you all about before we take a vote. So Annie?
Yes, ma'am. So this is an update to our 2015 climate change resolution. It adds some resolve statements on environmental injustice and a clear statement on carbon reduction. And this edit and the changes were drafted by our talented intern, Morgan Mulhern, who I've already spoken about, and reviewed by several experts in the field as well. So I will go ahead and read the results statements, and hopefully you all have had a chance to read it. It was distributed via the newsletter and email to all members prior to this meeting. So I will go ahead and read. There are 7, so hang in there with me. Therefore, be it resolved, the Minnesota Public Health Association, number 1, calls on policymakers and state and local leaders to integrate climate change solutions and climate justice into all federal, state, and local public health systems and programming, and to adopt policies and programs to create an equitable and just transition to 100% carbon-free economy by 2050. That was just one. The next one is urges for a just transition away from the use of coal, oil, and natural gas to clean, safe, and renewable energy and energy efficiency. Number 3, supports leadership by the Minnesota Department of Health, University of Minnesota System Schools, and other entities to study, analyze, provide data and recommendations, training, technical assistance, and funding in support of efforts to address the negative impacts of climate change on state and local communities. And number 4, take bold and timely action to promote awareness of environmental injustices that harm historically oppressed communities, undermine tribal sovereignty, disadvantage poor neighborhoods, and worsen the effects of climate change. 5, supports the funding of climate health risk assessments, expanded disease surveillance systems, early warning systems, and research on climate and health to strengthen Minnesota's capacity for an effective health response to climate threats. And 6, adopts an interdisciplinary and interprofessional approach to addressing climate change, including collaborations with other scientific, professional, and community organizations in Minnesota based on scientific evidence and public health expertise. And 7, pledges to help its members and other stakeholders readily access resources regarding climate change from credible sources, including the American Public Health Association, the Centers for Disease Control and Prevention, as well as organizations named above. And that is it. So I think we can open up the poll. If you don't mind, Mary. I may just have it open for a brief period. And just a reminder, this poll is intended for MPHA members.
It looks like about 75% of attendees have voted, which I'm guessing is most of our members. So I'll leave this open for a couple more seconds and then we'll show the results. Okay, thank you everyone for voting. Here are the results.
Okay. So the updated policy resolution on the impact of climate change and health passes with 97% voting in favor and one abstaining. Yep, I think one abstaining. So thank you, everyone. And we can put that into our other policy resolutions as well. So thanks everyone for your participation. Just as a reminder, be sure to check out the upcoming MPHA events on our website, mpha.net. And now it's my pleasure to introduce you to our next MPHA president for the 2021-2022 year. And please join me in a warm welcome for Liz Moe, and she would like to say a few words before we move on to our awards ceremony. So Liz.
Thank you so much, Kathy. And I want to thank you and all the outgoing members of the Governing Council for your leadership of MPHA through the last year. I've been thinking about the year ahead and thinking about, we've just reviewed our past year and it's been so successful, but I want to acknowledge that it was an unprecedented year for public health, for the country, for the world, incredible tumult. And we had so much opportunity in public health and with such visibility, especially in Minnesota, but also around the world. And so I want to just acknowledge the leadership that this group has offered, but also I want to I've been thinking about what this moment means for us as MPHA and how we are in an enormous time of growth. So I wanted to share with you my vision for MPHA in the time ahead and how that fits with MPHA's vision to be an active, independent voice for public health in Minnesota. As I said, we're at a pivotal moment. We've been a grassroots, just get it done, volunteer-driven organization for the past 100 years. And it was a big deal when we figured out our books and we hired Mary part-time as an executive director. And she has given us so much capacity that we didn't have. Well, I just know that she's made my life a lot easier and helped us really be organized. But as we are increasingly in the spotlight as an industry, as a profession, and as our skills are increasingly needed, we are being asked to do more than ever before, and resources that were never available before are suddenly it's making sense for them to flow to MPHA. And so in this time when our workforce, my friends in public health, I spent years at the Minnesota Department of Health, my friends are exhausted and have been working really hard for over a year. And my, people, colleagues, members we have across the industry are they're tired and facing burnout, but we have so much opportunity in addressing the twin pandemics of COVID and racism. And I think Minnesota has such a strong public health infrastructure. And I want to acknowledge the leadership of Commissioner Malcolm, who's here on the call, and we will acknowledge many other leaders in the next few moments. But I think that this is a moment for MPHA to do a little bit of review and reflection as we are about to leapfrog ahead. And so my 3 leadership goals for my term as president of MPHA, and hopefully setting the groundwork for some future work for us, are around impact, membership, and resources. And I want to tell you a little bit about those, and I will cut and paste the text into the chat so you can look at that. And I will go over this again at our next governing council meeting. But in terms of impact, what I'm thinking about is the way that we have better understanding our potential as MPHA at this moment when the world needs public health more than ever, and elevating the recognition, the public recognition that MPHA's health equity work and what that means, because we have been doing such powerful work in our health equity committee, and others across the organization have been really strong. And I think that I would love for MPHA to have that be something we're known for. And I think we are within circles of who know, but I want to be even more proud of it. I also want to increase the leverage of our legacy and the strengths of MPHA. There are stories that we tell each other about who we are and who we have been in different political climates and at different points in history. And I think those are really important to keep telling. Thank you to our history committee. I want to strengthen the impact of our advocacy, because I do think that we have a role outside of the health department, outside of the governmental infrastructure and the School of Public Health, to be more nimble sometimes and to be able to say things that other people may not be able to say. I want to increase our engagement and capacity of advocates for public health policy. And I think that's something that we'll be able to do with our Blue Cross sponsorship. In terms of membership, we had such a strong membership year, but I want to make sure that our membership structure reflects the place that we are now. It's no longer a good business idea to raise money based on events, to have our main source of funding be event-based fundraising. So let's look at that and let's see if there's another business model for keeping our organization sustainable and perhaps growing it. I also think that we should increase our capacity to recruit, engage, and diversify our membership. We are great at talking about race and equity, but how can we bolster our efforts at inclusion, and how can we do better? And I don't know, we'll ask ourselves, at being a place that everyone feels welcome. So that my third piece is deepening our inclusion and engagement of new perspectives and populations. Something that has been talked about for a long time in public health is our aging workforce. And so we want MPHA to be at the forefront of building the next workforce. And to do that, we need to make sure we're welcoming in and finding places for all different kinds of people and points of view. And I know we want to, but if we can work on cracking that nut of how to keep people engaged. And finally, as I mentioned before, alluded to, resources I think are going to be really important. We're so fortunate, and we've worked hard and positioned ourselves. We happen to be positioned to receive this extraordinary funding opportunity. And I think that there's the potential for other streams of funding to MPHA, but we need multiple resilient streams of revenue so that we can build the capacity to live up to our potential. And I don't know what that looks like. I don't have answers, but I do know that, especially when I think about Mary as our executive director and how great she's been for us, we need to be able to sustain her position and feel confident from year to year that can go forward, perhaps grow the position, perhaps we'll see. So, and that's not the only thing, but just we've really worked hard on our finances over the last 10 years. And I think now we have this foundation that we can think about multiple revenue streams. So by sharing all of this with you as fast as I can, I'm considering this the launch of phase 1, and it will continue through the end of July. Like I said, I'll talk more about this at our governing committee meeting in July 8th. But I'd like to charter a guiding team, a small guiding team, and just review some data we already have, maybe do some interviews, talk to people, review our membership data, look at a few of our policies. But it's meant to be this really inclusive and broad way of just making sure we're ready for the growth that is coming towards us, because it's really exciting that MPHA is getting the kind of recognition we're getting, and we are all stretched thin. So how can we position ourselves and bring that spirit of joy and togetherness and camaraderie and bring the best parts of our work together into what we're doing so that everybody feels it. So that's what I wanted to share with you high level. I'm really thinking about this and thinking about not just these next opportunities that we're seeing coming right now, but about how what MPHA means in Minnesota and how we can provide that leadership. So thank you very much. And now I'd like to that was fast. Feel free to contact me to talk more about it, but turn it over to Ann Sakowski and Shirley Sherry for our awards ceremony. Thank you very much.
Thank you, Liz. Really appreciate that. Good afternoon. My name is Ann Sakowski, and I'm co-chair of the Leadership Committee. And Shirley and I have the honor of soliciting nominations for awards every year. And we have what we do is each year review those and create a slate of candidates that we present to the board as for approval. And we have a great lineup today, very proud of our public health leaders and really want to honor them. I think we will go a little bit past 4:30, so I really hope that you can stay on and listen. I think that I'll just move through the awards. So the first award is for the Paul and Sheila Wellstone Public Health Achievement Award, and it honors an individual who has distinguished themselves in public health through an outstanding contribution to promote and protect the health of individuals, families, and the community, as well as demonstrate leadership and impact others' careers by making contributions. So I will now hand this over to Commissioner Jan Malcolm, who will introduce the awardee and the award.
Well, thank you very much, Ann. And I'm so glad I got to hear Liz's comments, and Kathy, thank you for your service. It has indeed been an incredible year for all of us, and I look forward to continued conversations with MPHA in the weeks and months to come. Well, I'm just so really tickled to be here today to be able to present the Paul and Sheila Wellstone Public Health Award to my colleague and friend and mentor, Jackie Dion. Longtime advocate for Minnesota's American Indian tribes and American Indian communities, Jackie is such a well-deserving recipient of this really special award. Jackie has a long history of working in public health, and this award, I just want to highlight her significant contributions to MDH. Jackie is the first person, and so far the only person, to serve as the Director of American Indian Health and Tribal Liaison at MDH since this office was formed in 2012. In this role, she serves as a bridge and an advocate between our tribal partners and MDH. This includes all of Minnesota's 11 tribes, as well as significant populations of American Indians living in our metropolitan areas, the Twin Cities, Duluth, and other urban areas throughout the state. Over the course of her time at MDH, Jackie has become a solid and consistent and very influential force to ensure that the tribal and American Indian perspective and needs are included in everything we do. Most noteworthy, I think, for all of us who are privileged to be her colleagues is the way that she goes about this work. She's always clear and direct, she's respectful, she's informed, she's flexible, and she is ferociously tenacious in her work to support tribes and American Indians in Minnesota, as well as having that same passion and commitment for her colleagues at MDH and in state government. One of our colleagues in the community had this to say in Jackie's nomination: building trust and strong working relationships takes time and sustained commitment, especially where historical events and trauma have broken trust with government. Jackie's work with Minnesota's tribal nations and urban Indian organizations to promote and protect the health of American Indians demonstrates that making a commitment over time can make a difference. Over time, Jackie's work has supported new approaches to maternal and child health, emergency preparedness, environmental health, the statewide health improvement partnership, and many other public health functions. In 2020, Jackie has worked with state officials and tribal leaders on the COVID-19 pandemic, having recognized immediately that COVID-19 would have a disproportionate and deadly effect on American Indians in Minnesota. Our tribal leaders absolutely knew that coronavirus cases in their communities would be likely to be severe. Jackie understood that and knew that the state public health department needed a strong response to work in unison together with our tribal and urban partners. So she pulled together an infrastructure within the state to ensure that tribal communities and American Indian urban communities could work together with local public health and other partners to emphasize preventive measures that would limit the virus's spread and the strain on hospitals in tribal communities or where significant numbers of American Indians reside. She is assured that staff are available to work directly with tribal and urban communities, and staff that work with MDH and local public health are fully informed on their needs and have worked on testing, distribution of personal protective equipment, case investigation and contact tracing, and most recently, vaccine distribution. She has made sure that tribal and urban communities receive critical resources to create their own infrastructure to respond. And indeed, feedback from our partners, our tribes and participants in interviews that we've done have noted that MDH has successfully supported tribes during this unprecedented time and have noted that MDH's approach has been different to this pandemic. More specifically, that our work at MDH has been more flexible and responsive to tribal and American needs than it has been in the past. And that's because of Jackie. Her tremendous leadership and insight has certainly contributed to helping us at MDH develop this different approach. Jackie exemplifies innovation, creativity, and courageous efforts to address health inequities and structural racism while promoting the health and well-being of American Indians in our state. Her influence and her contributions to public health, her impact on the careers and development of American Indian public health professionals in Minnesota is going to be recognized for many years to come. As one of our colleagues shared with me, no one deserves this award more than Jackie. Jackie has changed the nature of the relationship between the tribes and MDH for the betterment of both. And so it is indeed my great personal privilege to present this award to Jackie Dion. Congratulations, Jackie.
Thank you, Commissioner. Catch my breath, and if I was there, I would give you a big hug. So, big wish and thank you, and for you, Commissioner, as well, your leadership and mentorship of me during my journey here with public health is extremely invaluable. What can you say? You get really emotional when people say these things that are so encouraging. I think if I knew that person, boy, what an inspiration. And thank you, everybody. Folks that know me know that I am from the Turtle Mountain Chippewa tribe in North Dakota. It's not a Minnesota tribe, but closely related to the Ojibwe tribes in the northern part of the state. And in 1970, my family moved to Minnesota under the relocation BIA program. And then they divorced in 75, and my mom raised 5 kids by herself in the cities. And so that history of where I came from and who I am really molded my desire to work in community and really try to make a contribution, you know, to American Indian people, my heritage, my history. And my whole career has been about that since the time I just graduated from high school and then went to college. First generation out of my family to graduate from college. So with that, that's what defines me. That's who I am. That's the passion that I bring. my career in public health was by a set of circumstances that led me to MDH to be tribal liaison. There's no real educational program for tribal liaison. It just sort of happened. I applied, and Commissioner Ellinger and Jean Ayers and Melanie Peterson Hickey believed in me, brought me on to MDH, and here I am for the last 9 years. And I truly believe everything happens for a reason. I was meant to land here and really work over these years to improve, contribute, and hopefully make a difference over the years for our tribal and American Indian urban communities. And I have amazing support. My mom, who had passed on last year, my daughter and my grandbabies that I worked so hard for when she was little, and now my beautiful grandchildren, my family, my community, and the many elders that have passed on before me, a mentor, Laura Waterman Woodstock, and Normie Blake, tribal leadership, and all the tribal health directors, to give them all thanks. And the list of folks that nominated me and prior awardees, I'm humbled, and I thank you all. Miigwech.
Thank you, Jackie. Thank you, Commissioner Malcolm. I wish I could pass out tissues. Really moved by this and really appreciate your leadership. We're going to move to the second award, which is the Albert Justice Chesley Award, and it honors an individual who has distinguished themselves in the field of public health and who, through their membership, have made a definite contribution to the Minnesota Public Health Association. And I'm pleased to ask Jaime Martinez to introduce this award.
Thank you. I have to tell you, I was really proud to be selected to sort of introduce Annie to receive this award. I have to tell you that in the process of doing all this, and there were several of us who nominated Annie, and in the process, I learned a lot about Annie, even things that I didn't know, that I was impressed with a lot of the activities she has been involved in. So Annie, I'm going to give her background and some of the highlights. Annie Holland has always, and this is verified by the other nominees, has always been energized by fighting for marginalized communities and individuals. She started her career at the healthcare for the homeless in St. Paul, where she advocated for clients to get clinical support they needed, including helping register them for medical assistance. She also had the good fortune of joining MPHA, and that was fortunate for us as well back around when she arrived in St. Paul and Minneapolis. She has a Master's of Public Health from Boston University with a focus on health policy and management from 2007. And Annie began work building bridges between health plans and public health, social services, and small health plans in Massachusetts called Commonwealth Care Alliance. And this health plan covered only people with disabilities and seniors, most of whom were immigrants to the United States. She arranged consumer meetings for members, including interpreters and transportation, so their voices would be heard and included improvements of activities in the health plan. So right from the beginning, she was very involved in assisting marginalized communities. So luckily in 2011, Annie moved back to Minnesota and joined the Minnesota Public Health Association. And shortly after that, she signed up to be co-chair of the Policy and Advocacy Committee and has been acting in that capacity for the last 10 years. And I have admired that about Annie. When I first learned about Annie, it was through the Policy Committee. And and since then, she has been tenacious in doing that work. And she has been involved in a variety of advocacy activities, including the Day at the Capitol, and collaborating with coalitions and organizations to provide advocacy opportunities, such as Minnesotans for Healthy Kids Coalition, Protect Minnesota, and Minnesotans for a Smoke-Free Coalition. All the big kinds of topics that impact the health and safety of Minnesotans. Annie has also organized and facilitated numerous MPHA conference presentations featuring lawmakers, lobbyists, sessions, including 2 sessions on gun violence prevention and 1 on local health plan and SHIP funding. Most recently, she worked with the Health Equity Committee to organize a pre-conference session around anti-racism and health equity advocacy. So those who have worked closely with Annie witness her tireless dedication to taking actions that address social determinants of health. And even the current CEO, UCare, was excited that Annie was being nominated and joined in on this nomination, which is pretty excellent. So Annie has worked at UCare since 2013 and supports the health plan's efforts to serve its diverse membership through program flexibility and support services tailored to individual needs. She has been in her current role of county manager since 2017. And in her current role, Annie oversees relationships between UCare and county public health, economic assistance, and human services. This role requires some of that fighting spirit that I mentioned before for underrepresented communities to ensure the priorities and needs of local agencies are heard and acted upon within UCare in collaboration with many partner organizations that are necessary to achieve systemic changes to improve health. So everyone that I spoke to that joined in on this nomination was so excited for Annie. And she's everybody sort of thought of her as an unsung hero who just keeps focused on improving health, particularly of communities that have been marginalized over time. So it was my privilege to put together some of this for the nomination and with some assistance from all the nominees. So Annie, you are loved and admired by many people for the work you do, and for sure for the future work you will continue to do in Minnesota. So I now turn it over to Annie for any comments.
Hi, May, thank you so much. And I have to say, I'm really quite humbled to be honored alongside Jackie and the other awardees, Delaney, and Amira Dawe and Governor Walsh. And Jackie, that was beautiful. Someone asked me if I was going to cry too, and I was crying, just like typing up my thoughts as I was making this. So I don't know if I will now, but I just have so much gratitude for everyone involved and thinking of me and submitting this nomination. And frankly, and my husband, who's listening in right now, can attest to this. I've been struggling with this, just feeling unworthy when there are so many strong leaders that I get to the privilege of working alongside every day and admiring from afar, like Jackie. But I do have to, and in particular with COVID, since I have not been in the direct response and have just been so impressed and wowed by all of the work going on throughout the state. But in any case, so I'm just going to thank a whole bunch of people, because I feel that that's my comfort zone. And I do, I truly do have so much gratitude for my family and my colleagues at NPHA and at UCare, and some who have joined today. And, I've told a few folks this, that I really measure my time volunteering with NPHA by my children and where they're at. So my first child, Alex, was born just before I started volunteering, and he's now 11. And then My second son, Sebastian, is now 8, and he came on stage with me at my first conference, first MPHA conference when he was a newborn. He's now 8. And my third son, Jude, who I don't think has graced the stage yet, but he has, you know, I love him to pieces, and he's just about burst my capacity for parenting, volunteering, and working. But there's a reason why I'm able to juggle all the things I do. And one of those reasons is my husband, Shandon, who makes it all happen and keeps everything running, and is such a wonderful co-parent with me. We met while working at the Dorothy Day Center 17 years ago, and I have not stopped learning from his compassionate style and care for the most vulnerable people. And here we go. I'm crying, Wendy. You got it. So and just how he sees value in everyone and holds me up through it all. And all of my MPHA mentors and co-advocates, including you, Jaime, have been such a leader and mentor for me throughout the years. And also, you know, really from the beginning, and one of the reasons I ended up with working at UCare is Carol Berg, who is on the call today, and she's has been just such a tremendous role model for me in so many ways in public health and with her work at UCare. She's paved the way, and I keep telling our leaders that I'm just doing my best Carol Berg impression every day. Another selfless and compassionate person to try to model myself after. And Laura Klein has been my co-chair for many, many years. And I think since between son 1 and 2, that's if we're gonna do it that way. And she's just such a tremendous, wonderful person who leads with me with calm and grace as we navigate this all together. So there are so many people, and I should probably wrap it up, but I do just want to note too that in addition to the great mentors and leaders with MPHA, I'm also really blessed to have strong leadership at UCare and to be supported by Stephanie Schwartz, Gita Worcester, Mark Trainer, who was kind enough to send something into you, Jaime. But just wanted to note that I consider this award a challenge, but I've also been recently challenged at UCare by having the opportunity to expand my work. So I now oversee relationships with counties and also tribal nations. So that is, and my title has changed since I sent my information into you, Jaime. So I'm now the County Tribal and Public Health Manager with UCare. So just another way that I'm truly lucky to be supported and held in a welcoming circle of public health advocates and leaders, and so appreciate, and I'm looking forward to living up to the expectations of this award in the years to come, and doubling down on commitment to racial and health equity and sustainable public health into the future. So thanks, everyone.
Thank you, Annie, and congratulations on your new role as well. I'm now going to introduce the Harvey G. Rogers Environmental Health Leadership Award, and this honors an individual who has, through years of dedication, distinguished service, and technical contribution, promoted the public's health through preservation of the environment. And I will pass it to Shirley Sherry, my co-chair, to make the introduction.
Good afternoon, and thank you. The people who nominated Amira were not able to make it. They're all nurses, and so they're working right now. And just to give a little taste of how you can really expand your learnings in that, some of these nurses participated in a couple of the MPHA Health Equity Committee meetings, and they also have been following some of the people that that the Health Equity Committee has highlighted. A little bit about Amira. She's been interested in public health since she was a child. Immigrated from Somalia to Minnesota in 2000. And through the years, her desire to support her Twin Cities Somali community grew. And this led her to attend the University of Minnesota School of Public Health for her MPH degree. And while in school, Amira identified and addressed several health issues that threaten the health of Somalis, including the use of dangerous skin lightening creams used by many Somali and African women. And Amira stated that these women inherited the belief from the colonization of Africa that the lighter you are, the better. And in Africa, having lighter skin means economic mobility, plus men are attracted to light-skinned women. And using these creams has become popular, including among some of her own relatives and friends. So finding out about this through some of her studies in one of her classes, it just spurred her into action. And she was able to sample some cream or get some samples of creams, have them tested and share the results with government officials. And then the FDA ended up issuing a consumer warning on the creams. And then next, Amira created the Beauty Well Project to combat the stigma faced by women with darker skin and take on the industry that promotes them in beauty in a jar. So the Beauty Well Project is a nonprofit and it aims to end skin lightening practices and chemical exposures and create a toxic-free environment. Amira has worked at MDH on a biomonitoring study, is a 2020 Bush Fellow, and is an instructor at the University of Minnesota School of Public Health, the Division of Environmental Health Science, teaching the environmental justice and policy and practice course at the Public Health Institute. So these are just a number of her accomplishments. Amira's tenacious dedication to improving the health of women distinguishes her as a deserving candidate for this award, and her leadership and service has made her a valuable contributor to public health improvements throughout her career thus far. So we're pleased to recognize Amira's commitment to improving the health of the public, and we're honored that she is receiving this award. So I'll pass it on to you, Amira.
Thank you so much, Shirley, for the introduction, and thanks to all of you. I'm so honored to be here and for this opportunity to receive this award. This means a lot to me. It means a lot to the communities that I serve, the individuals that I serve, women who are struggling on a daily basis because of colorism. And colorism, it's not only limited to the Somalis, it's a global problem. Any community that have experienced colonization or slavery experiences colorism. And as a result, many women are using toxic products to change their skin color to fit in the society that we're in, and that is exposing them to a number of toxic chemicals like mercury, and also that's poisoning our environment. So by default, it impacts all of us that are in Minnesota or nationwide. So thank you so much. I want also to thank the individuals, the nurses who nominated me for this award, and all of you who worked in the process of the selection process of the award. So thank you so much for recognizing me for this award. I also want to thank my mentors. I don't do this alone. I have a lot of mentors who have mentored me over the years. I have been doing this work for the last 10 years. And so I want to thank all my professors and as well as my colleagues and also my mentors, and through Beautywell, my board members who are amazing and support me every day through this journey of the work that I do, and also the community members and the community leaders. So I want to thank all of you. I also want to thank Jackie and Annie, all of you, the amazing work that you do. Thank you, Jackie. I had the privilege and the honor of working with you when I was at MDH. So thank you so much for the work that you do. I'm becoming emotional as well. So thanks to all of you, and I'm honored to be with all of you. And I hope that we all collaborate and work together to improve the public health and the environment of our state and nationwide as we now move into post-COVID. I hope that the issues that I work on also becomes an issue that systems focus as well. So thank you so much.
Well, thank you, Amira. I wish everyone was saying in the chat that we wish we could applaud. We almost need a soundtrack. I hope that next year we can all be in person and pass out tissues and applaud all of us and all of our work. The next award is the B. Robert Lewis Award. And this award is presented to an elected official who has distinguished themselves in aggressive pursuit to establish and maintain health as a human right and to secure optimal community and personal health. And Kathleen will make this award.
So this award recognizes elected officials who have distinguished themselves in public health through leadership and impact in their work. And the honor goes to our 41st governor, Governor Tim Walsh. And he has dedicated his career to public service through the COVID pandemic and has demonstrated strong commitment to protect the health, safety, and well-being of all Minnesotans. Over the past year, Governor Tim Walsh has followed the science. He's worked closely with public health experts to keep COVID-related decisions based on best available public health data. He took critical steps to change the pandemic's trajectory, as well as to save lives. Using data and research-driven approach, Governor Walsh closely monitored key metrics, including deaths, hospitalizations, daily case numbers, and test positivity rates, and analyzed data to show where the largest rates of transmission were occurring. Based on the evolving science, understanding around transmission of COVID in communities, Governor Walsh issued executive orders and implemented restrictions as necessary to protect public health while balancing personal well-being of Minnesotans, as well as the Minnesota's economy. Finally, Governor Walsh has taken steps to address systemic racism and discrimination. His first executive order as governor was when he established One Minnesota Council on Inclusion and Equity, which this council was charged with ensuring that everyone in Minnesota has an opportunity to thrive. The governor's office also collaborated with Minnesota state agencies to forge the Community Resilience and Recovery Work Group, and that this was to address the disproportionate impacts of COVID on American Indian, Black, Asian, Latinx, and other communities of color, and work towards a recovery of dignity and resiliency. This year, Governor Walsh also signed an executive order to establish the Governor's Community Council on Inclusion and Equity to develop and implement policies that address inequities in Minnesota. Governor Walsh has always recognized that housing is critical to Minnesotans' health and well-being, especially during the pandemic and times of financial uncertainty. He has issued an eviction moratorium and announced $100 million for housing assistance programs to quell eviction and homelessness and to assure housing stability. The governor's at-risk populations work group advocates for safe housing for people experiencing homelessness, victims of domestic violence or exploitation and human trafficking, the elderly, and others at increased risk of COVID. In summary, throughout these unprecedented times, Governor Walsh has distinguished himself as a public health champion to keep Minnesotans safe and address issues of the systemic racism and discrimination. And do we have somebody from the governor's office or not?
Unfortunately, the governor is very busy. He's quite engaged with his staff with the legislature right now. So he sends regrets and is unable to join us. And so I think we all can understand what's happening there. So
there's not a day goes by where I don't thank my lucky stars that we live in the state of Minnesota and have Governor Walsh as our governor right now. Incredible decision-making, and the toughest, I think, he didn't sign up for COVID and all the other things that he's had to deal with. So a very well-deserved award, and I know he graciously accepted. And I'm glad he's working on the budget, or I'll be laid off soon. Thank you.
Yep, thank you, Kathleen. Okay, the final and most important award is the MPHA Student Achievement Award. I say that because it is honoring a student who has achieved distinction in public health work, and our students are our future leaders. And Mary Grand will make the introduction.
Hi, everyone. And Anne, thank you. I couldn't agree more. Building up our future workforce is so important. And it gives me great pleasure to introduce Delaney Anderson to everyone. And if you don't, some of you already know her, but only virtually, because Delaney moved here last August in 2020 to relocate for graduate school. So with everything that happened in the pandemic, moving, starting a new community, new school, new jobs, new volunteering opportunities, all of this, Delaney has handled incredibly well, as I'll tell you about briefly. So Delaney she previously lived in both Alabama and California. And as I said, she quickly became engaged in activities in Minnesota. Delaney started as a member of the membership committee. And after she got to know the group pretty quickly, she volunteered to host a Zoom coffee break. And Delaney's excellent with virtual networking. She's an engaged person, and she was able to make meaningful relationships with MPHA colleagues. Next, Delaney joined the annual conference planning committee. And as you, I think, have heard throughout, she devoted untold hours to planning and executing our virtual conference. She made a specific targeted outreach to over 50 Minnesota schools and programs that were related to public health to try to introduce students to the conference and help also with their student scholarship applications, whether they're through the school or connecting them to MPHA's student scholarships. Delaney's development with MPHA continues to grow as she's begun co-chairing the MPHA communications and membership committees. Throughout Delaney's public health activities, she brings an empathetic, inclusive, and logical perspective to her work. Delaney's ethics are grounded in social justice and racial equity, and she's thoughtfully raised important issues for consideration during her committee work. A lot of us at MPHA have known each other previously, and it's always really refreshing to get a fresh set of eyes and someone to ask, have you thought about this? Or, why are we doing it this way? And Delaney's always very open and, thinking about things and asking good questions. Delaney Anderson, I could go on and on about her, but I will just close with, she's an avid learner. She's got considerable leadership skills, and it's really a pleasure to work with her as a student and to have her in further involvement in MPHA. She's got a bright future and voice in public health. So Delaney, congratulations on being the MPHA 2021 Student Achievement Award winner.
Thank you. I was doing breathing exercises to stay calm, so I'm trying my best not to lose it. I'd like to say hello to all of my MPHA friends, and whether you're a member or not, and I see my family on here too. For the MPHA members and friends, you've probably seen me talk way too much on Zoom, especially during the annual conference, and yet you still invited me again to talk publicly. I want to acknowledge how much of an honor this is to receive this. It's something I'm going to definitely point at next time my imposter syndrome acts up. Annie, you said imposter syndrome. Imagine how I feel following all of y'all. This is such an honor, and I think all of us here can recognize that this is a really weird time to be a student in public health. I haven't met any of you in person, and I've only met a handful of my classmates out in the wild. It's been an isolating year for us all, but the work that MPHA does really makes me hopeful about building the better, healthier future that we want to see. I think most people who have been stuck on a Zoom call with me, and Ellen threw that in the chat, know that I got involved in MPHA after Ellen Solaris, as the membership chair, hosted a new members coffee break. And I thought it would be fun to hang out with this group of friendly professionals in my free time, and I was right. Through both the membership committee and the annual meeting conference, or the annual conference committee, I have gotten to see the power of personal connection across our field, and how hosting events, uplifting all of your hard work, not mine, all of your hard work here as public health professionals, helps us build resilience both professionally and personally. To say I am ecstatic about helping lead MPHA as an incoming membership and communications co-chair. Yes, it's one committee now. We know the naming was confusing. We're sorry, hang with us. It's just an absolute understatement. I look boldly to the future of MPHA as we continue our work as an inclusive, anti-racist public health organization that so many before me, and hopefully so many after me, will continue to build upon. I would not be the aspiring young professional I am today without the guidance and mentorship of many of you here, especially my family, sorry, especially Mary Grand, especially Liz Moe, especially Ellen Solaris, to name a few. It takes time to talk to me when I'm bugging you about things or being annoying. Mary, I know that's the word you're looking for when you say I bring up things, and I appreciate the support you have given me. I want to thank the leadership committee for organizing this, and I really hope to see all of you at a future membership and communications event.
Thank you, Delaney. Thank you all for staying. I'm so moved by your remarks, and I just want to say, as we leave this meeting in gratitude, continue to think of others who are deserving of leadership awards for next year. And I just want to thank Shirley, my co-chair, for all of her work on this event as well. So congratulations to the 2021 award winners. And I think we can all applaud.
Great job. Thank you, everyone.
Back to you, Mary, or to Kathleen, excuse me.
I don't have anything further to say. Mary, do you? If Mary has anything, thank you everyone for attending this, and apologies for going over, but I think it was worth it. Congratulations to all our award winners. It was such a wonderful award ceremony, and hopefully next time this is all going to be in person. So hope to see everyone soon. Thanks everyone. Have a great evening. Bye-bye.
Thanks everyone.